Okay, so we talked about the acronym RICE. Remember, it's rest, ice, compression, and elevation, okay? When you have a minor sprain to your ligament, okay? All right, you put an antibiotic ointment on a minor cut. You got 3 days ago, and now you have a rash around the cut. What should you do? That's right, you need to stop using that antibiotic ointment because you've developed an allergic reaction to it, right? So true or false, remove a tick using nail polish and petroleum jelly. That's false. Let's go over how you actually remove a tick, because I want to go over this specifically because of Lyme disease and the Rocky Mountain spotted fever. Okay? You use a fine tip tweezer to grasp the tick as close to the skin surface as possible. You pull upward with a steady, even pressure. Do not twist or jerk the tick. This can cause the mouth parts to break off and remain in the skin. If this happens, remove the mouth parts with tweezers. If you are unable to remove the mouth easily with clean tweezers, leave it alone and let the skin heal. After removing a tick, thoroughly clean the bite area with your hands with rubbing alcohol, an iodine scrub, or soap and water, and then dispose of the live tick by immersing in alcohol or placing it in a sealed bag container, wrapping it tightly in tape, or flushing it down the toilet. Never crush a tick with your fingers, okay? Never. Some of the early warning signs of an infected tick bite are fever, chills, headaches, fatigue, muscle and joint aches, and swollen lymph nodes. A rash, okay, may have a bullseye appearance, okay, nausea, vomiting, abdominal pain, red eyes. And Lyme disease is no jokes, guys. It lasts with you the rest of your life. And that's why you need, if you've been bitten by a tick and I see any of those symptoms, then you need to take care of it and get to seek medical attention with your doctor as soon as possible. Okay. So a classmate faints. You know he's been ill. It's been 2 minutes and he is still not awake. What should you do? Remember that 1 to 2 minutes. You need to call for help because they've been unconscious for way too long. Okay. So think about how you would respond to different first aid situations. Okay. So here is the first aid responder checklist exercise. This is the homework for this. You need to, there's 15 scenarios. You can see this one. We had a picnic lunch outside today. I sat beside an anthill. I have a rash on my arm. What is the treatment? Okay, so that was what, number 3. So number 3, describe the injury. Obviously, ant got bit by either fire ants or some other type of ants. What should be done? Okay, obviously monitor it, but you can put some topical ant ointment on there to stop the rash, some Benadryl, things like that. But you have to answer all 15 scenarios, okay? And some of those scenarios, maybe you've experienced them directly or had it done to you, or you helped somebody with an injury, okay? How was it treated? Did you treat it differently back then than what you know now, okay? And then think about how to remember the treatment for common injuries. Remember the warning signs, okay? Because sometimes a common injury can turn into a major injury if it's not taken care of properly, okay? All right, so now you have to fill out the performance assessment task. I will post that on the Google Classroom, both of those things for you guys to fill out for your homework, okay? Allergic means having an abnormal physical reaction to something eaten, touched, or inhaled. A medication used to fight infection is called, that's right, an antibiotic, okay, the Neosporin that you should have in your first aid kit in your car. Hydrogen peroxide is an antiseptic cleaning liquid. That should also be in your first aid kits. Okay. A type of tissue that holds bones together is called a ligament. Those are the things you can strain. Okay, with the strain, you need to use RICE, rest, ice, compression, elevation. Okay. Rabies is a type of virus that affects the nervous system, and it's usually spread through the saliva of infected animals. If you get it bitten by the dog and it breaks the skin, you need to, the owner, that dog needs to, you have to see the paper to see if it's been inoculated for rabies. If not, then you're in a world of hurt. You're going to get all kinds of shots, because rabies shots is a series of 10 of them, and they're horrible. Okay, so we go back to the essential question: how can you help someone with a common injury? Now you know what a common injury is, and you should be able to help people. Okay, thank you for your time.